Everyone, my name is Furhan Babar, and today I will provide a briefing on New York's response to COVID-19 pandemic, covering key phases of the crisis, the action taken, challenges faced, and the lessons we have learned for the future preparedness. So, um, the COVID-19 pandemic tested New York City resilience like no other event in modern day history. As the nation's largest and most densely populated city, New York City became the early epicenter of the outbreak, forcing rapid mobilization across all sectors of public health, healthcare, and emergency management. This briefing provides an overview of how the city responded to this crisis, from its first reported case in March 2020 to the ongoing recovery efforts shaping public health preparedness today. The presentation will highlight key phases of the response, major actions taken, unmet needs that remain, and lessons learned that continue to inform our approach to future emergencies. So, going over the community profile, New York City is home to about 8.8 million people, one of the most diverse urban population in the world, with nearly a third of residents foreign born. The city median household income is around $76,000, and 17% of households live below the poverty line. New York City also has over 550 nursing homes, 10 correction facilities, and more than 100 universities with dormitories, as well as 100 plus homeless shelters. High population density, nearly 27,000 people per square mile. This also contributed to rapid COVID-19 spread, especially in low income neighborhoods where healthcare access was already unequal. The timeline and statistics of COVID-19. The city confirmed its first COVID-19 case on March 1st of 2020. By April 2020, death exceeded 800 per day, which is very significant. And by 2023, total cases reached approximately 3.5 million cases. The good news was the vaccination began on December 14 of 2020, and by 2023, 90% of the adults had received at least one dose, meaning that the goal was to create a herd immunity to defeat the virus. Field hospitals expanded capacity, and overall, more than 45,000 New Yorkers lost their lives to COVID-19. This timeline reminds us how quickly the crisis evolved from panic to mass vaccination within a year. Nature and length of the event. COVID-19 was a natural infectious event caused by a SARS-CoV-2. New York endured several major waves. The initial wave, the Delta wave, which was the most deadliest wave of all, Omicron, and then post-Omicron phases, with the most severe period from March 2020 through mid of 2023. Currently, the city is in recovery and preparedness phase, focusing on resilience, interagency coordination, and long-term system strengthening. If you look at the charts on the right side, you'll see the timeline that it shows when the first case was reported and when the peak hit. And same thing goes for the date of hospitalization for the patients who were infected by COVID, and at the same time the death. There's a direct correlation with the increase in cases to the hospitalization of these cases and then to the death as well. Moving on in our presentation to the next slide. Public health response in New York City, major action. So in response, New York City declared a state of emergency on March 12th of 2020. Measures included mask mandates, lockdowns, and social distancing. The city launched widespread testing and vaccination centers, including mobile units in undeserved communities. The Test and Trace Corp conducted contact tracing, and telehealth visits were being more frequently given to patients instead of asking them to come into the hospitals or clinics, and mental health hotlines were expanded rapidly. The city also improved real-time data systems through academic partnership to strengthen the situational awareness and coordination. The future preparedness and recovery. As the city moved into recovery, efforts shifted towards rebuilding trust and improving preparedness. New York City founded the Pandemic Response Institute in 2021. focusing on research, education, and data-driven planning. Community resilience program grew as well, addressing vaccine equity, public education, and inter-system coordination. The city also expanded mental health services and launched ongoing preparedness training to strengthen crisis management capacity. Unfulfilled needs and new challenges. Despite progress, many needs remain unfulfilled. Food insecurity and housing instability persisted, while affordable childcare continued to limit recovery for working families. Furthermore, a widespread mental health crisis and workforce burnout affected both residents and healthcare providers. Uh, Persistent inequities in healthcare access and digital connectivity continue to divide communities as of now. These challenges remind us that recovery is still an ongoing effort and it's still not fully complete. Food insecurity rose from 9% at pre-pandemic level to 14% in 2021, still above 12% in 2024. 1.1 million New York City residents are still affected. And when it comes to housing instability, over 70,000 people remain in New York City shelters, a 20% increase since 2020. When it comes to childcare access, 1 in 4 low-income families lack affordable childcare options, and behavioral health calls to New York City well hotline surged 35% during pandemic peak. Demand remains alleviated as of now. And when it comes to workforce shortages, healthcare staffing is pretty um, tough to hire healthcare providers right now. Since I work in the hospital, I know it for firsthand. And healthcare staffing vaccines average 10 to 12% across New York City health and hospital facilities. So to put this in numbers, food insecurity rose from 9% pre-pandemic to 14%, which is pretty significant. And these figures illustrate how social and economic stressor outs the initial crisis. Moving on. So from lessons learned and recommendation for future preparedness. We have learned that early detection, rapid testing, and multilingual risk. Sorry about that. We have learned that early detection, rapid testing, and multi-risk communication are vital. Congregate facilities like nursing home and shelters must be prioritized in every outbreak plan. And more importantly, stockpiles of PPEs and ventilators must be maintained, and data systems should be permanently funded to support real-time monitoring. Cross-sector collaboration between government, academia, and community organizations remain key to an effective response. Earlier risk communication, deploy multilingual, which is also really a big key for us because New York is a melting pot. Just alone in Queens, there are over 250 languages that are being spoken, people from different diverse groups, different countries. So it's key that we do provide bilingual services when it comes to not only medical services, but also support services. Um, so deploy multilingual and community-based messaging within 72 hours of first confirmed case. Prioritize congregate setting. Focus on early testing, PPE distribution, and on-site response in nursing homes, jails, and shelters. Equity by design. Embed equity matrix and response plan, use neighborhood level data to target resource distribution, and when it comes to workforce resilience, implement surge staffing plans, mental health support, and retention incentives for essential workers. Opinion, what could have been done differently? So this is a key slide. Earlier, federal and local coordination could have saved many more lives, right? I think there was a disconnect between the local agencies compared to federal agencies, and hence a lot more lives were lost, which could have been saved. Prioritize protection in nursing home and homeless shelters. It's another key where a lot of people were crammed into a very small facility where one infected person would make, you know, a cluster or would cause a cluster and get a lot more people sick. Another key area is ensure transparent communication to combat misinformation. There was a lot of misinformation going on that COVID-19 is just like a flu and it'll go away and it's not infectious as, you know, prematurely it was thought to be as not as infectious as it turned out to be. Maintain stockpile of PPE. That was another big issue we had. Initially, hospitals were not ready. There was a lot of PPEs missing. The ventilators were not there, or not ready for the amount of patients or the magnitude of patients that were coming into the hospitals. Expand public health education for crisis literacy. Ensure fair resource allocation to marginalized communities. Regular simulation drills for emergency preparedness. So overall, in conclusion, as we look back to COVID-19 pandemic, which pushed New York City to its limit, but also showed how strong and adaptable our communities can be. We learned a lot about the importance of communication, equity, and coordination across every level of our system. While challenges like workforce shortages and health and inequities still remain, the progress we have made gives us a good foundation to build on. And moving forward, it is about using those lessons to stay ready, stay connected, and make sure every New Yorker is better protected the next time we face a public crisis as such. So hopefully, things will work out better since now we are much more prepared. So thank you so much for your time and for your continued commitment to protecting the health and resilience of our city. Thanks.